Hey everybody, welcome to episode 2 of series where we're looking at laser parameters using C wider. So we're on number 2, so we're looking at wavelength. So wavelength is what dictates how far the light can travel. So I think it used to be a common misconception that it was to do with power, and power obviously impacts, how much of that light goes and how bright that light, so the irradiance. But realistically, if we don't have the right wavelength, that light won't be able to travel the distance it needs to go. So if you think back to the electromagnetic spectrum, we work on the near infrared spectrum, red and near infrared. And when we zoom in a bit more, we look at this therapeutic window. So this is between 600 and 1100 nanometers, and this is called the therapeutic window because any wavelength that we use in this spectrum will have a therapeutic effect on tissue. Now, the issue is that obviously we have shorter and we have longer wavelengths. So different wavelengths, depending on how long they are, can reach different depths. But then we have a second issue, and it's called incidental absorbers. So along the way, as the light travels through, it passes through different substances. So obviously we've got melanin, hemoglobin, oxyhemoglobin, fat, water, all those things. And they're going to steal the light, if they can, as it passes through. So they're called incidental absorbers because we don't want to lose light to those things. We want as much light as possible to hit that target tissue. So if we're losing light on the way, we're not going to get as much light hit where we really want it to. So we try to select wavelengths that are able to penetrate through those different incidental absorbers as best as possible without losing too much light. And it's really variable on which wavelengths can pass through which. But as you can kind of see from the table, kind of as we go higher up the scale, those absorbers become less of an issue. But even so, some wavelengths are still better at passing through different things than others. So the two most common wavelengths, the most well researched in vet med that we use is 810 and 980. And 810 is a great all-rounder for photobiomodulation, but it can be absorbed in melanin. So if you've got darker skin patients, they'll quite readily absorb this. So we then switch to 980, which is great as well for pain management. It can pass through more successfully on that melanin. It is then more readily absorbed by water. So we don't have a perfect wavelength. So that's why often we use combination, and depending on the parameters that you input for that patient will depend on which wavelength. So it doesn't matter about having lots of different wavelengths in terms of, the more isn't necessarily the merrier. It all comes down to, okay, what are you trying to do? Where are you trying to reach? What's those patient characteristics? And using the right wavelength to be able to pass through those incidental absorbers. So typically we do, like I say, all the research that are clinical efficacy papers in vet med that I'm aware of at this point use 810, 980, and they have the best success. So that's your roundup of wavelengths. That's how the light travels to the target tissue. If we don't have the right wavelength, we can have all the light we want, but it's never going to get there. So I hope that makes sense around what the wavelengths do.